Get ready to hear the truth, the whole truth, and nothing but the truth about the United States healthcare system. With your host of the Medical Truth Podcast, James Egidio.
Hi, I'm James Egidio, your host of the Medical Truth Podcast, the podcast that tells the truth, the whole truth, and nothing but the truth about the American healthcare system. For a first-time parent with a child who presents with illness and injury, it can be very stressful, especially when your child is presenting with symptoms. So many things are running through your head to sort out the issues. My guest specializes in pediatric cardiology for over 15 years and has written numerous articles and lectures on childhood illnesses related to the cardiovascular system. My guest, Dr. Robert Rollins, is here to discuss multisystem inflammatory disease versus Kawasaki disease on the Medical Truth Podcast. It is an honor and a blessing to have on the Medical Truth Podcast my guest, Dr. Robert Rollins. Hi, Dr. Rollins. Welcome to the Medical Truth Podcast. How are you doing today?
James. Appreciate you having me.
Absolutely. Absolutely. It's an honor and a blessing to have you on the Medical Truth Podcast. Just for the viewers and listeners of the Medical Truth Podcast, just basically who you are and what you do.
Yeah, I am a pediatric and fetal cardiologist here in Southern Nevada. I've been out of my training now for about 18 years. Born and raised in Las Vegas, Nevada. I'm a native guy here. Finished my training up at the University of Southern California and came back here in 2006. And I've been part of a practice here in Southern Nevada since that time. And it's been interesting to watch what's been going on in the world since then.
Yeah, I can hear you on that. I can understand. Today, I wanted to just address for the viewers and listeners of the Medical Truth Podcast a little bit about, because you hear this every once in a while in the media and online about multisystem inflammatory syndrome versus Kawasaki disease. And what is multisystem inflammatory syndrome and Kawasaki disease?
Well, Kawasaki disease is something well known by pediatric cardiologists. It's the number one acquired cardiac disease state for children. Most of what we deal with as pediatric cardiologists is congenital heart disease, a structural heart disease. So if you will, plumbing. We've got different abnormalities with regards to the great arteries and the vessels and how they're hooked up to the ventricles. But Kawasaki disease is something that generally affects a child with a normal heart. It starts off with a fever, and then the diagnosis is really made by criteria. The criteria are basically fever for greater than 5 days. You usually have a rash, and the rash can be any type of rash. You usually have mucocutaneous findings where the typical description by the pediatricians is that the tongue looks like a strawberry. The lips are very red and swollen, oftentimes become cracked because the children are very, very dehydrated throughout a lot of this. Typically you can have an enlarged lymph node, and unusually it's only on one side of the neck. The hands and the feet can be very swollen, and they can get erythematous or reddened. And once this criteria has kind of been met, because there's really it's an unusual disease, we don't know what causes it. But once these criteria are met, then the pediatric cardiologist gets consulted, and they come in and take a history and do a physical examination. And typically we'll look at a 1280 kg in any of the labs that have been performed and perform an echocardiographic study. And that's where the biggest interest for us comes in. The most lethal problem with regards to Kawasaki disease is aneurysms on the coronary arteries of the heart. And most of your viewers probably know that the coronary arteries are the arteries that branch off of the root of the aorta, the biggest artery that comes out of the left side of the heart and feeds the actual heart muscle its blood flow. And if you get saccular aneurysms or abnormalities in those coronary arteries, it's the same as having some type of a plaque or a blockage, or some kind of the medical word for a blockage is stenosis, or abnormal flow in those coronary arteries, it basically can cause a heart attack in a child or a baby. So it's something that we take very, very serious. And when those type of criteria are seen, we do the consultation, we evaluate the child, and then we give our recommendations with regards to treatment.
So, okay, and then multi-system inflammatory syndrome, is it the same thing, or is it different, or do they present with the same symptoms? What's the difference?
It's not the same. Great question. It's not the same thing, but in fact, to my knowledge, multisystem inflammatory syndrome in children really didn't exist until COVID came along. And usually, it could really be characterized almost as a type of hyperinflammatory syndrome. It's similar in that respect to Kawasaki, because Kawasaki is a widespread, big inflammatory response, like a vasculitis, and that's why it hits the endothelium or the inner lining of those coronary vessels. Multisystem inflammatory syndrome in children is very, very similar in its presentation, with the exception that it usually affects other systems, just like it's termed multisystem inflammatory syndrome in children. And it can be very quick to onset. It typically happens most severely in children who are older than ones that get Kawasaki disease, and they can really have a rapid course of deterioration and require a lot of supportive treatment, and sometimes even die from it.
So when you talk about Kawasaki disease versus multi-system inflammatory syndrome, what age ranges are we talking about with each one of these diseases?
Well, the official, there are different criteria, of course, with, I'll use the term MISC. It's an easier to say over and over than multisystem inflammatory syndrome of children. The different criteria have been put out by different entities, World Health Organization, CDC, and other centers like Boston Children's and things like this. But they describe it as having to happen between 0 and 19 years of age. In my experience, the kids that seem to be the sickest with it and the most severely affected are in that middle school range, kind of 10, 12 to 14 years of age, where with Kawasaki's disease, it tends to be more of a toddler to an early school age child. And of course, there are cases of each one running the whole gamut of the spectrum of age, but that seems to be one big difference between them.
Yeah. What causes these diseases?
Good question. We don't know. I studied at Children's Hospital Los Angeles under a gentleman, Dr. Takahashi, who had a great interest in Kawasaki disease. And I learned from him as a mentor, and he has been studying it for a lot of his career and life and never found the cause. And similarly, we don't know the cause of MISC. There's no serum test that you can say, boom, this is what it is, or some kind of a culture. But I will tell you that MISC, for the most part, didn't become like it is or even appear really until COVID-19 became so prevalent after we started seeing the pandemic. Kawasaki disease has popped up almost like a viral, like viruses will. You'll have a flu season, or you'll have a season with viruses called respiratory syncytial virus or adenovirus, and it seems to have that type of a pattern. So we've always thought that the etiologic agent or the cause for Kawasaki's was a virus, and then probably some type of hyperimmune response. And I truly believe that your genetic, you have a genetic predisposition. Some people will probably have this hyperimmune response that have certain genes that others won't.
Yeah. So I guess it sounds like what you're saying too, going back to to COVID, was that pre-vaccine or post-vaccine rollout as far as the prevalence of seeing the MISC?
I believe MISC showed up in 2020. And I don't have the statistics for Nevada right in front of me, but we are the only group that takes care of children with heart disease in our state. And I don't believe we started seeing it until the spring or the summer of 2021. We had our first cases of MIS-C then. In fact, I think I was the doctor who was on call for the first couple of cases of this, and they were very severe. And they were, I think the one child was 12 and another one was 11, 12, and they were significant.
So spring or summer of 2021, I know the vaccine rollout started, I think, the end of 2020, if I'm not mistaken, correct?
Yes, I believe so. Yes.
So it sounds like it's post-vaccine prevalence where you see the MIS-C more. So then, let's say, February, March of 2020, when COVID first came on the scene, or at least was announced. Now, we know, that COVID itself evolved in 2019. I believe it was like September, October, November, right around that time, that window of time, but wasn't announced. And the first cases weren't reported, I believe, until February of 2020, even into March, right?
Yeah.
Yeah.
I'm not sure at what point. I know that, of course, adults really jumped on the bandwagon with vaccine earlier than children, and everybody has their own experience. But my experience fielding questions in the office with families and their children, of course, there was a lot of hesitancy early on. So I think that the children that were vaccinated came a bit later than the adults, of course. You may know that data better than I do.
Yeah.
But in fact, I was concerned. So my understanding of this, and I don't believe it's truly a vaccine. I think that substance is being put into the body that actually creates antigen, and if antigen in fact is the etiology, and it's one of the suspected etiologies, I believe, for MIS-C. Because you have to have the antigen there for the immune response to take hold of. One of my fears was that MIS-C may become significantly more prevalent after vaccine rollout. There was a lot of MIS-C afterward, but it seemed, in my experience, that the MIS-C in the beginning, when we started to see it, was where all of these severe cases were. And then afterward, there was a lot less severity, but a lot more cases. I think, in fact, that may have been even overestimated. I don't know where people, get their data from when they report it in these papers, but if they're taking hospital diagnoses, I know my experience here in Nevada is that the emergency rooms and the intensivists were giving the label and the presumptive diagnosis of MIS-C oftentimes when, in fact, it was not. There was a lot of overcall because, as you know, with children in our country, we're very, very careful, and we're going to treat more often than we're not, as long as we think the risk-benefit ratio dictates it.
Yeah, because that was going to be one of my questions to you: is what kind of challenges did you experience in 2020 and going into 2021 with COVID? Because it seemed like that was the only diagnosis that anybody had for the last 2.5, almost now going into 3.5 years with COVID. Everything was COVID. I mean, we never heard about cancer anymore. We didn't hear about diabetes. We didn't hear about blood pressure. Everything was COVID, COVID, COVID. So what kind of challenges did you experience during COVID, especially since the symptoms seem like they present the same as COVID with these two diseases?
Yeah, well, I think some of the data shows that Kawasaki's disease, in fact, dropped down, but because there's so much overlap with the presenting symptoms, I'm sure that there were errors in diagnosis, and in fact, we probably had a lot of a lot more Kawasaki than we saw during the MISC era, because it was being called MISC. The good thing from a pediatric cardiology standpoint is the treatment is almost identical. The treatment usually consists of administering intravenous immunoglobulin and aspirin, because you can have clotting abnormalities. And anytime you have flow dynamic changes in those coronary arteries, you want to keep the blood thinned enough so that you don't create clots on the inside of the coronary arteries, because that, of course, can be fatal for a child. But if children didn't respond sometimes to the gamma globulin, or the intravenous immunoglobulin, the IVIG we call it, we would use corticosteroids at times to really tamp down that immune response, and sometimes even immune modulators. So I think all that data gets garbled up between Kawasaki and MISC. So I don't know, it would take a lot of time and somebody dedicating a lot of their own clinical time to just kind of tease all those things apart. But you're right, I agree with you. Everything was COVID. And in fact, I think a lot of death certificates were probably attributed to COVID errantly.
Yeah. I know I interviewed several physicians, and one in particular was Dr. Scott Jensen out of Minnesota, who was instructed to falsify death certificates. And when he refused to do that, the state of Minnesota went after his medical license, and they're still doing that,
That's a shame.
And it is. And getting back to the some of the byproducts in these vaccines, I interviewed Dr. Maria Mahalcha, and she's talking about, hydrogel and all kinds of stuff in the vaccine. And I know that you read a lot of articles and you see a lot of medical articles that talk about, messenger RNA, but it's not messenger RNA. It's other components that's all tied to, other things, other motives, I should say, metals as well. And we do know there are metals that have been found in vaccines even prior to the COVID vaccine.
Yeah, you bring up a good point with these. And again, I think the word vaccine just falls out of our mouths, but I think you probably agree, is not a vaccine.
No.
Doesn't prevent any kind of transmission of the disease. In fact, people I know personally who got the quotes unquote vaccine have had COVID repeatedly and seem to pass it easier than people that have not been injected.
Right. And that goes back to, I think, what you were saying about the immune system. I think it seems as though, and maybe you could correct me on this, that this particular bioweapon is attacking the immune system.
Yes. I have, like a lot of doctors, I have just kind of kept my own anecdotal list of again, I'm saying it, vaccine issues. I have heard some of your previous podcasts, and I've heard you say that you personally don't know anybody who's died from COVID. But
not at all.
You know several people that have died from the vaccine. I tend to agree with that. I see thousands of patients and families. So children often, they always come in with their parent or parents, and sometimes siblings. So there's a lot of talk about these types of things. And with the amount of people that I see, I've been amazed with the amount of death that I have not heard about from COVID. And not one of my patients, to my knowledge, has ever died from it. Right. But I know several physician friends and other people in this industry that have died after they've been injected with this thing. And I'm not an immunologist, but one of the other things I was very concerned with, because I believe that the SARS-CoV-1 testing early on had a big roadblock with I think when it was in animal testing, there were some deaths, and I don't know all this data wonderfully, but I read about things called antibody dependent enhancement, where in fact, if you don't have a good, strong vaccine, even made with traditional methods, that those can be extremely dangerous, and they can actually foster in and make the virus more virulent in your body when you're trying to actually keep it out and get an immune response to it. So all of these things were very concerning to me when this started to come out, in addition to all the other information. So I've avoided this for myself and my family personally.
Yeah, and then you're talking about mask mandates and wearing mask. It's a recipe for disaster, because just from that alone, just basic biology tells you that you're basically harboring so many germs on these masks. And I said it from day one. As soon as you open up a box of masks and you start touching them, and then you put them on over your face, and you start touching the mask and adjusting the mask and doing all kinds of things, and you're out in the unsterile environment. Obviously, I mean, anything past an operating room, you're pretty much past a sterile field, and you're out there all day and you're touching things, and you're again touching the mask. There's no way of avoiding COVID or anything for that matter. I mean, and then you're just destroying your immune system.
I agree.
Right.
I mean, outside of a well-fitting N95, and even that has been shown to not cover you. I mean, most of the general public that you see that is engaging in the mask wearing are wearing cloth and generalized surgical and exam room masks that I believe have absolutely zero power in stopping this virus from being transmitted. And in fact, they cause a lot of problems. And in my patient population too, oftentimes oxygen saturations are not in the normal range, like they are for you and I, who have two ventricles and a normal, circulatory system. So having babies and young children who have typical oxygen saturation normal is, probably 93, 94, 95 and greater. Most people are between 90 and 100% walking around all the time in room air, which is 21%, oxygen in our air. And I have a lot of patients who live in the level of between 75 and 85% all the time. So to have a mask on them and have them basically, to some degree, be hypoventilating and rebreathing a lot of carbon dioxide, it can be a very uncomfortable thing for them, and I think more harmful.
Sure. Especially if you're rebreathing CO2. I think, doesn't that put the blood into an acidic state, or more of an acidic state?
Sure,
when that happens?
Oh, yeah, you're not blowing off that CO2, you can cause all kinds of problems. Yeah.
Sure. I mean, there was just such bad advice from day one, and there were so many inconsistencies and so many mixed messages about masking, about, of course, obviously the bioweapon being good. Now they're pushing it again. They're pushing the mask again. Like I said, and you mentioned, I know of 8 people personally that died from the vaccine, and they were young, healthy people. 30 is the youngest, healthy. His brother found him dead in his bathroom when he came home, and some other friends, that couple that had gotten turbo cancer a month or two afterwards. They were healthy, and all of a sudden liver cancer, and I mean, it's just horrible.
I have similar experience. Several physician friends. This turbo cancer term, it seems very fitting. It seems that malignancy of unusual types can come on, and then they can run their course very rapidly and violently before death. And I have had the experience with several people I know of having underlying illnesses that were fairly well controlled in their lives. And these are people, these are middle-aged physicians, 40s and 50s, And then suddenly, after they had the vaccine, these illnesses that they had been dealing with, in whatever way they were dealing with them, suddenly became more aggressive, and they succumbed to it, which I thought was very interesting. There seems to be a lot of inflammatory cascade and cytokine storm. I personally am not as adept at dealing with some of the adult dysrhythmias, but I have seen a significant rise in talking with other adult colleagues in arrhythmias like atrial fibrillation and atrial flutter. It seems to be increasing. I'd be interested to see what the adult cardiologists are seeing with their data.
Yeah. What's your theory on this inflammatory response with this vaccine? I mean, they say it's messenger RNA. We know messenger RNA synthesizes the proteins, and this particular vaccine is supposed to synthesize the spike protein, which are the spikes. So how does that work? What's the mechanism of action if that in fact it is messenger RNA and it is producing these spikes?
Yeah, good question. I think there's a lot of unknown here. And I'm skeptical, as you are, as to what really and wholly is in this. And I think it may even differ by lot numbers and the vaccine type. I know that the two main players that are messenger RNA type of created were the Moderna and the Pfizer.
Right.
But if it seems to me that if your body is given a message that doesn't go away that quickly, and it's making these spike proteins and they're circulating in the bloodstream throughout the body, and who knows if they're depositing it at certain places, and it keeps being made. I mean, that seems to tell me that the inflammatory response that normally is probably pretty limited in a traditional vaccine is ongoing in these. And I think that we know now in medicine that inflammation is a big driver of a lot of our chronic diseases and causes a lot of morbidity and mortality. So things that were probably fairly well controlled or at bay with good diets and some medications are now probably very hard to control because of this significant amount of inflammation that people have in their bodies that's circulating around all the time. I think that's I think that's probably a lot of what this etiology is. I don't know if that's been shown to be the case, but I think that as well, from a medical literature and reporting standpoint, we're going to have a problem with getting to the truth. That's why I love the title of your podcast, Medical Truth Podcast.
Thanks.
I commend you for what you're doing.
Thank you. Thanks. So, in other words, what you're saying too, I mean, when these spikes, let's take the spikes themselves, right? They get produced through the messenger RNA. They produce spike proteins. These spike proteins are circulating through the circulatory system. You're a pediatric cardiologist. So what they're like, I guess, in essence, are like tiny, tiny little golf tees that are circulating through the vascular system. And they're what doing? Tearing up the endothelial cells in the blood vessels? Is that what they're doing?
I'm not so sure that they have any direct effect on it, but when they are, and I'm not an immunologist, but I think when our system and the antibodies that we produce grab onto these things, it starts a cascade. It starts an immune complex. And we know that interleukin 1, interleukin 6, interleukin 8, and things like this, when this complex is formed, it starts a whole cascade of events within the human body that can really overreact. And we see that with autoimmune diseases, things like systemic lupus erythematosus, Sjogren's syndrome, things like that. So, it's really a combination of what we put into the body and what the body's doing with it.
Yeah. It's interesting too, because there is a major autoimmune response to this particular, I call bioweapon, but it just seems like it's like a multi systemic has a multisystemic effect on people who have had diabetes. Their diabetes is raging. People that have, let's say, the oncogenes for cancers, which we all have, but they just get expressed. It's just accelerating that. It's just hyper actively creating these systems that maybe in the future we're going to weaken, and you're going to succumb to, let's say, whatever is all of a sudden it's in an accelerated pace, is what it seems like to me.
Yeah. I can tell you, having been around so many health practitioners that did partake in this injection. I mean, for years and years, we as physicians, we've been required to get influenza vaccination and other things to practice. It's part of a part of a requirement sometimes just to even get your privileges at a hospital. So I can tell you that I never knew anybody who had a sore arm or a fever or got so sick that they couldn't come to work for 2 days from getting their flu shot.
Right.
I personally never did. And a lot of times each year I get 2 flu shots because my son would make me get a second one with him at sometimes when I go to the doctor, because he didn't get one unless I did. But I know a lot of people who had to stay home for 1, 2, 3 days, 72 hours or so after getting this quotes unquote COVID vaccine because they were so sick they couldn't even get out of bed. And they had a lot of pain, they had a lot of inflammation and redness and erythema in their arm. And they were so sick with high fever they couldn't even come to work for a couple of days. It's just something very, very different about what they've done with this.
Yeah, I interviewed Dr. William Makis out of Canada. He's a radiological oncologist, and he's diligent about posting vaccine injury on Substack. And he reports vaccine injury and death amongst pilots, physicians up in Canada. And he was mentioning, I think when they first rolled out the vaccine, I think within 2 months, they lost like 60 physicians in Canada. And getting back to what you're talking about with these lot numbers and these lots, one of my second episodes was with a Dr. Yoho, and we were talking about what's called hot lots. That's a vaccination research researcher's term for various strengths of vaccines. And my philosophy, and this is my belief, and I don't know how true this is, but this is kind of what I should use the word speculate, is that because the vaccine was under what's called emergency use authorization, that the pharmaceutical companies were not liable for any injury or death. It became like a real big research study is what it became. And my philosophy is that when they send these vaccines to distribute them nationwide, every single lot number, as you know, is tied to that county or that state, and everything's recorded by the administrator of the vaccination. And what I think they did personally is that they used various strengths, and this was one big worldwide research study, because I don't believe any high profile people that were on, and I won't mention the names, that were on TV getting injections were receiving the actual vaccination, or at least they were receiving the control, the saline solution is my take. Right? Yeah. Politicians,
I wouldn't put that
celebrities, absolutely. So, and we'll get into on the next episode, we'll talk about myocarditis and pericarditis, and I want to talk to you about athletes and why this is creating a lot of pericarditis and myocarditis in young athletes. But we'll talk about that in the next episode, the next one we do. But that's my take, is that this was a big research project, and it's not over. I think they're going to continue this narrative with mask and more bioweapons, I call them, not vaccines. And they clearly stated that they want to depopulate, and Gates is involved. That's another thing that's, to me, just is a red flag when, Gates gets involved and he talks about, we need, we need to depopulate, and we need to get most of the planet vaccinated with basically this poison. So it's just too many red flags, too many inconsistencies. And it's sad. It's sad where we're at especially in the medical industry. I'm sure you've seen a lot of changes in the last 3 years.
I agree. And as a physician, but also as a Christian, I think that we're told in the Word of God, in the Bible, that we need to be wary of deception. And I think it's certainly in my lifetime, I think there is more deception going on in the world than has ever been before. I'm sure, it's always been around, but I personally, from what I've read over the last few years, you can see that there's error in medical literature and reporting. In science, it used to be one of those fields that most people at least felt that it was hands off, that you didn't manipulate things, that it wasn't money driven. It was, and we as physicians, and especially pediatric physicians, most of us have gone into this because we love people, man, and we want to help.
Right.
We want to make these kids have as normal life as they can. And I think the deception is running rampant, and we're warned about that all throughout the Word. And I listen to that, and I read that, and I try and live my life by that. And I think we need to do more of that.
Yeah, well, this is definitely a spiritual battle. This is good versus evil, and evil's definitely got its grips on it. But of course, we know in the end, God wins. We know that.
Yes. I listen to a lot of apologetics, and I learn a bit about that. And one gentleman I listen to often says, science doesn't say anything, scientists do. And we know what our nature is and where that can go and what happens with it. So I think we all have to have a healthy skepticism, and we got to watch out for this deception, because I think there's a lot of it going on right in front of our eyes, and we got to be careful.
Yeah, and I tell people that all the time. I parrot it constantly: is take the politics, the optics of politics out of this the spiritual battle that we're going through. Take the politics out of it. It's about your God-given right to choose what you want to do when it comes to this bioweapon and to the mask and all this other stuff that these bureaucrats keep pushing on us, right? We have the right, God-given right, to choose that. Don't you agree?
Oh, definitely agree. I think that if you take the stance in life that you're going to just seek truth, I think that's going to come to it. But you've got to read both sides of every story. You've got to stand on both sides of the political aisle, so to speak. You have to look for the truth in all things, and you've got to have that healthy skepticism. And when things just don't pass the sniff test, there's probably a reason for it.
Absolutely. I know that's the gift of faith through Jesus Christ, is that discerning spirit that we are able to read between the lines by listening to the Holy Spirit that's indwelt in us, to say, okay, something's wrong. Something's not adding up. Am I right?
Yeah. Oh yeah. I've seen in a world of identity politics and other things, I don't think there's ever been any time in my life when there's been more division, at least in our country, than there ever has been. And our healthcare system and this virus have been at the forefront as tools as part of that division. And I myself have to remind myself a lot that a man named Jesus Christ came and hung on a cross to die for sins for people, and he died for all of the sins for all of the people, even people that I don't necessarily like listen to, or I think hold contrary views, or who lie and deceive and have been shown to. You know what? He loves them like he loves us. And I have to remember that our real battle is the one that we don't see.
Yeah.
I totally agree with you.
Ephesians 6, putting on the full armor of God.
Yeah.
Yeah. Yeah. I mean, it's going to be interesting. But again, I think leaning into your faith, believing in Jesus Christ as your Lord and Savior will open up that door for, like I say, that discerning spirit to sort out the good and the evil that's going on. You know, he's going to lead us in the right direction and what we need to do. Yes, we're living in exciting times. And I think that the changing times are it's like birth pangs, man. It's going to get more severe, and they're going to be, closer together. Things are going to be happening, so we got to be ready for it and stand for truth. Yeah, Matthew 24, where Jesus predicts the future, he says that. Yes. It's one of many stats. Yes. What advice do you have for parents who are listening and watching this podcast episode when it comes to vaccines and when it comes to, this bioweapon? Well, I personally get very, very close, and I love the humanistic side of medicine with my families and my kids that I take care of. I would say to families that have a good heart-to-heart talk with your physician and the most trusted physicians that you have, whether it be your primary care doctor, whether it be a subspecialist, if your children requires to see one of them, talk to them. Have good, deep conversations about them. Ask them what they truly feel about all of this, and do it with multiple physicians. And go out and read that data for yourselves, and ask the physician to explain those things to you. And then look around you and see if what they're telling you jives with what you're seeing. Anybody in the world can make their own observations and do their own scientific studies, so to speak. And come up with their own theories and their own observances and their own data, so to speak. Don't just turn on the television, open your ear and let them ram whatever they think is the right thing for you to think and feel and put that into your brain. I think that our media has become very, very good at not reporting news, but of giving you rhetoric and giving you propaganda, especially where it's in a field that they really weren't trained to give you that information about. So if you're fine with trusting a few people that have a lot of power that sit at the top on some pyramid in the government or some agency, then that's fine. But I as a professional have found that to some point, and with a lot of things that can't be trusted, with history and with this whole pandemic. So you need to do your own work. And when it comes to your kids' lives, you really got to be careful, because right there, that's what we hold and cherish in this country more than anything. This beautiful, democratically elected Constitution Republic that I live in. I'm watching the road around me, and it's just a shame. But I think people like you, people like me, and others that kind of push back against a lot of this other baloney are going to have a key role in helping people. Yeah. Thank you so much for joining me for this episode of the Medical Truth Podcast, Dr. Rollins. I really appreciate it. Thank you, James, for having me. I totally appreciate being on it. Yeah, and we'll get you on again. We'll talk about myocarditis and pericarditis. We'll take one disease state at a time. There's a lot to unpack here. Yeah, thank you. Thanks again. I'll make you a regular. Thank you. I'd love it. All right, sir. Thank you so much. God bless.
Thanks for listening to the Medical Truth Podcast. For the latest episodes, go to www.medicaltruthpodcast.com. You can also find the Medical Truth Podcast on Rumble, as well as all the major podcast platforms like Apple Podcast, Spotify, Stitcher, and iHeart.